Hi, it's Catherine McQuaid from Trust Robin. We are a patient and clinician education group. We work in both video and app formats. And we are here at the home screen of our digital partner, IMD Health. We are going to walk through one of the three ways in which our materials are used. And today we're going to talk about how the community pharmacist uses our materials. We are also used in the consulting pharmacist setting. This could be on-site in a senior care, a home care, long-term facility. And we're also used by physicians and clinicians in patient consult settings. Before we get into a patient, a demonstration of a patient consult that might happen if you are a retail pharmacist in a store or a pharmacist in a hospital pharmacy, let's just make a couple of observations about how the materials are organized and how you might use them. You'll notice that there is an educate a patient here, and if you're a first-time user, there's lots of easy how to use it, guidelines before you get going, so it's not a big learning curve. And you'll also notice that the materials are organized by health topics and by health associations. This tells us that the materials come, for the most part, from approved and medically, clinically compliant sources like health education associations and or advocacy groups. And therefore, let's go today to educate a patient. The first thing that happens is that you choose, obviously, the gender and you put in an email. I'm going to put in my own email for demonstration purposes. When you put in the emails, maybe they are part of the care team, maybe it's another family member. You will notice that we are taken immediately to the topics and that a icon for the email has shown up. This means that as we review documents, they will be attached and therefore will be very easily sent along by email once that consultation is finished. The elements of my shortcuts have been organized by disease states, and these are the situations that I encounter most often in the retail pharmacy. They could be also organized by your specialty. I've also put on my shortcuts screen the resources. These are the things that I find are useful and that clients generally like to use. Therefore, I've got them easily accessible so I don't have to spend a lot of time. I can actually concentrate on the client, the patient in front of me. This is our content. We'll come back to that. And the treatment options. We see that these are, in some cases, profiles that have come from the manufacturers or distributors, so I know that they're trustworthy, and I know that they're going to be understandable by a client. So this is a patient that is coming in, and usually a patient will indicate symptoms, and it'll be a meaningful conversation if we organize by the place on the body that presenting symptoms appear. But the content is also organized by systemic topics. So I'll just quickly let you see the kinds of topics that are organized by systemic topic. And we know that this is a diabetic patient. So for purposes of our demonstration, I'm going to go to diabetes, and I know that this is a type 2 diabetic patient, so I'm going to go there next. But you can see that the topics are very useful for general discussions in a retail setting. So the type 2 diabetes file, therefore, is going to show me that we've got these documents are now going into the email file to be sent as soon as we finish the conversation. And I'm going to also point out that this is Mayo Clinic material. We have general information for this patient now. They have asked about complaints on their feet, and I see that we've got some notes in here for skin conditions. I'll be talking to them in a second about some of the foot care materials that they might want to refer to. But I'm also going to include, because this is an older patient, I get the sense that they don't have a complete understanding of the things that they can do for themselves relative to their condition, and therefore I'm going to include some information for nutrition and other choices that they could make. They've mentioned that they have a young family member who is well educated in that area, and I'm going to encourage this patient to share that. I'm also going to include tips for healthy eating, because I know this is very well written. It's easily understandable, general principles that when we talk again, I think might be useful for that discussion. So now I'm going to move back to the type 2 diabetes classification, and I'm going to go to treatment options. You see there was lifestyle, there's treatment, there's also professional tools. So there are the types of insulins. I don't know that yet, so I'm going to leave that all for and perhaps another visit, or in consultation with the prescribing physician. But you can see that the information is easily available for a discussion with the other care team members. So I today am going to concentrate on simply the lifestyle parts for this patient, because I don't feel like I'm in a position to make any of those observations for the moment. So I'm going to go back to diabetes, and I'm going to go now to diabetic foot and neuropathy. A good way for them to get a sense of how this complication might occur. I'm going to go to symptoms, because this is something that they might want to be able to, when they go to their physician, also take along with them. It is, although it has medical discussions, I think it is pretty easily understood. And I'm going to also put something in on prevention, so that they can start to educate themselves and maybe take some care. This could be very useful in terms of how they might be contributing without knowing it. Again, it's Mayo Clinic material, so it's very well developed. The lifestyle parts of this also include professional tools. That's the Canadian Diabetic Association, which I've already included. So this is the materials. There are now 4 attachments that have been put on this patient consult situation, and so I'm ready now to go and send this to them. We can review the materials that are here. We can take off any of the documents that either don't seem relevant, or we can go back in and we can add some more. But because it will go by email, I'm going to put a little note on to make it more friendly. Looking forward to our next conversation, because this could be somebody who will interface with the prescribing physician. I'm going to take off all the compliance materials, compliance notes, and I will send it. Therefore, it's gone to the patient. So that is a demonstration of how these materials can be used. Well, I'll just quickly go in here and note that there are other topics of interest for retail pharmacies. There are additional bundled services that you may be promoting in the community, or with health insurers, or with employer benefit programs. The flu is very useful. Biosimilars is a whole training program in and of itself. These are general topics useful for technicians, for the other healthcare specialists who might be involved, RPNs, people who are in long-term care or home care. So we have e-learning that can be done, and we also note that we can do surveys if you want to participate in sort of clinical trials or post-visit uses. And now the documents are often the patient visit and the use of documentation can be used for other reasons. So I mentioned the payer or employee wellness and prevention programs. These materials obviously would be very easily shared and can help build the profile of your retail pharmacy or your hospital pharmacy in the community, with either referring specialists and or other caregivers, a podiatrist, a physiotherapist, a perhaps nursing facility. The digital resources are easily shared relative to disease states and to other specialists. There could be adjacent services we mentioned. Wellness is one of the areas in which we like to work. We like to contribute in the community. And I mentioned that we are a health education company. We produce a variety of different topics for perhaps over-the-counter category support and or general topics that someone who may not be a specialist would like to feel very comfortable that they're giving accurate information. So this is an example of another place to go, because video is often opened and used because they're very easily understood and they're perhaps a bit more engaging. I'm going to move to probiotics, and we'll just listen to it for a second. Know that all of these materials can also be used post-discharge and help promote and enhance some of the other categories and products on the retail pharmacy shelf, such as ostomy, infusion supplies, perhaps COPD. If you have a facility in your neighborhood, maybe it's a nice way to get to know either the supply and purchasing areas of a senior care or home care facility, and the obvious categories that can contribute are things like pain relief and additional materials that are helpful for a patient to have before they make decisions. So we're back to the IND patient education classification of our materials, and it will help when we're doing quality QPP, quality payment program documentation, because patient education is obviously an area that we can demonstrate, and this is, of course, MIPS in the U.S. In Canada, there are implied quality reimbursement and dispensary functions that can help contribute. So that's an overview of how you might use the IMD Trust Robin platform. And I will note that you can sign up in the link in the bottom of the YouTube posting and visit us on LinkedIn to get to know us better. you can have access to these materials